their compatriots in all the commands across the country for intensifying the wider sensitization lectures and advocacy messages to every
It will be produced in a very toxic environment. The cells, commonly the sperm cells, look tired, weak. Sometimes we call them lazy sperms. And they will not be able to now swim from the vagina, locate the cervical opening, and then travel up into the uterus to go and meet fallopian tube to meet the egg, and normal fertilization take place. So you find out that just as the people that abuse these drugs are, mentally unstable, usually they stagger, incoherent speech, is the same way the sperm cells behave. As you see the man staggering, so the sperm, if at all, is deposited in the vagina, will be staggering. Of course, you don't expect such sperm to go and do anything reasonable. Even if they meet the egg, they will only be looking at the egg as in, who is this one? What can I help you? What can I do? You know, in a similar manner, people that abuse this drug, they get themselves out of their senses. Even when there is a woman, you find out that sexual activity they will not be able to do. So, like I said, they behave in similar manner. Of course, when erectile dysfunction sets in, of course, the individual will find it very difficult to have normal sexual relationship. Of course, substance abuse comes with testicular damage. Some substance like cocaine can damage testicular tissue and reduce sperm production, and also what we call epigenetic changes. Substance abuse can lead to uh, damage to the genetic material of these individuals, of course, affecting quality and leading to infertility. Um, of all of these that I have mentioned, both in men and women, they have a common mechanism at which they cause infertility. Oxidative stress. Here is a situation whereby substance abuse leads to oxidative stress, damaging reproductive cells and tissue. Now, like I said earlier, sperms and egg have their conditions at which it must be met for them to be produced and also do the expected roles. The second way by which it causes its damage is by inflammation. It tends to cause chronic inflammation affecting reproductive health. Like I said earlier, if there is chronic inflammation taking place, you can imagine that the ovary will produce egg and just release, you know, in a space. Now, if there has been inflammation, healing comes with fibrosis, and it's likely going to block the fallopian tube. In men, it may lead to what we call obstructive azoospermia. get good results. We need to go way beyond that. We have to look at these people, I know, in totality of their environment, where they're coming from, how this individual will be detoxified. I mean, uh, where the psychologists now come do their own part of it. It's a teamwork. It's a teamwork. It's not an individual or a specialist duty to be able to handle these individuals. So, but however, before any medical attention, we need to see that these individuals were able to overcome the substance abuse. They no longer abuse these substances, and then we can now offer them the appropriate help. So they need to seek professional help, consult a healthcare provider, therapist, counselor, or who specialize in addiction and fertility. Of course, for the fertility aspect, yes, we urologists, that's where we come in the management of this individual. But you agree with me, a lot need to be done before coming to us. And that is why attending to their fertility issue is the last on the list. Of course, they need to go for detoxification in the early stage of their management. And then, of course, counseling comes in, individuals and couples therapy to address emotional and relationship issues. I have a particular one in where the man just refused to talk to his wife completely. So there is a relational issue. So you see, if that is not overcome, I mean, there will be no good progress and outcome. Of course, sometimes handling this individual has to be in specialized groups where, group like Narcotic Anonymous or Smart Recovery for Community Support are available. I'm so happy in the the presentation earlier, we were made to understand that there are, counselors or support group available by the agency, for people who need such support. Now, medication or assisted treatment comes in certain condition whereby the abusing substance has an antidote. When administered, it will be able to reduce that strong desire for the individual to demand for the substance he abused. So, in appropriate situations, these people are to be given those antidotes. It's not for me to mention at this presentation. Lifestyle changes. We need to encourage healthy habits, stress management and nutrition counseling, like we have seen earlier. These need to be encouraged. And of course, fertility treatment. This individual will be evaluated and diagnosis established. So depend on the diagnosis. Specific treatment is tailored towards the problem so as to be able to overcome the situation and let the couple have the joy of having their own children. Sometimes, assisted reproduction may be employed. A situation whereby, like I said earlier, in men where the sperms are found to be weak, they're no longer energetic to do what they're supposed to do, the sperms can be harvested, selected, and used in assisted reproduction, IVF. Alternative therapies can be employed where such services are available. For example, we may consider acupuncture, yoga, mindfulness for stress reduction and well-being. The abusers should be encouraged to get themselves in one of these alternative therapies. Of course, partner support involve partners in treatment and fertility planning. Here, if it's a woman that is involved, the man should be fully carried along in the management of his wife, vice versa. Uh, it's usually difficult, very difficult for women, you know, to to pass through, you know, a spouse who is involved in substance abuse and infertility. You know, in our environment, when there is inability to conceive, usually the women are blamed, you know, but in a situation whereby, you know, it's obvious that the problem is with the man, you know, psychologically, it damages these women. So we need to have that behind our mind, and then we give these women the appropriate support. And of course, their treatment is not a one-time thing. It's a continuous thing. You know, we need to monitor them post-treatment, how they are doing. We need to engage them. We don't leave them in their own space. The likelihood of relapse is always there. Um, it can be very difficult getting an addict out of substance abuse. If you have, you know, experience managing them, you know that this very aspect of continuous monitoring is very, 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 very important. I have someone who he relapsed about 3 times. So what I do is regularly in the morning I call him to say hello. In the evening I call him to say hello. So he got so used to my call. Even if I didn't call, I know I started reducing my number of calls. But you know, in him, he's expecting my call. So why am I calling him? He makes sure he does not go back to his substance that he abused. And we give God the glory. I mean, he came out of it. He always called to say, "Thank you very much for being with me. You did not like abandon me. You tolerated me. You showed me love and care." And at the point, he told himself he has to abide by all management strategies for our sake. We that were attending to him, not even for his own sake. So sometimes it can be quite difficult. Yes. So, like I said, um, diagnosis of infertility has to be evaluated. Of course, so the evaluation and all of that is not for this discussion. Once diagnosis is established, along with other managing team, appropriate treatment should be employed. In conclusion, let's remember that overcoming substance abuse and achieving fertility requires one, patience and empathy. Also, commitment on the part of the abuser and the managing team. These two has to come together to, you know, form a formidable force of one common goal of getting the patient out of substance abuse, and also their life to be cleaned up and enjoy like any other person. And also, of course, comprehensive treatment plan, both psychological, clinical, social, and more importantly, rehabilitation. This individual, most sincerely, most times they need to be rehabilitated. So you can see that management of this individual is not only time consuming, it also involves a lot of resources, because you can't get someone out and leave him without doing anything. So we thank God that we have a lot of non-governmental organizations coming in to rehabilitate and make sure that this individual found a source of livelihood, that they will be able to maintain their family life in the general society. Thank you very much for listening.
All right, thank you very much, there, Dr. Kabir. Dr. Kabir has been talking to us for the last 30 minutes thereabout. We appreciate those explicit details provided in your presentation. I'll tell you, I've been busy writing, taking points, jotting down takeaways from this conversation. I believe I've been seeing quite a number of people trooping in also and dropping messages in our DM. Thank you very much. We'd like to appreciate Dr. Kabir Danjuma Usman. Again, Dr. Kabir is a consultant urologist, and he's been able to tie the nexus clearly between substance abuse and infertility in men and women these past minutes. Thank you once again, Dr. Kabir. Now, Kabir, now quickly, before we get to our engagement, let's appreciate some of our compatriots joining us from across Nigeria and the world this hour. Ahmad, that's Ahmad at one pen. That's Ahmad changes his name every time. It used to be Ahmad at Arewa Poet, but now Ahmad at one pen, something like that. All right, Ponju, thank you, Ponju, for being part of the conversation today. City Boy at City of Mongbola, thank you. John Bamshak Husseini, thank you for being part of the conversation today. Save the Consumers, thank you for coming around. Kaz at Kamal _Soye, thank you for coming around. Taka Atib, Muazu Musa Bogu, thank you for coming around. Fatima Umar Sani, Mayowa Haruna Pauls, Ezekiel Joshua, Femi Adeolu, Daje, Professor Sadiq, thank you for coming around. Benga Daramola, thank you, Benga, for coming around. We'll also have Maswell, Dr. Loretta Ekanim. Loretta is a senior member of this platform. She joins us from Chicago, Illinois. Thank you, Loretta. Also, Madam Maria Ilubohi. Madam Maria Ilubohi, thank you for being part of the conversation today. Mohammed Bafo, Gideon, Suleiman, and my colleague, Sir Ezekiel Ekpeso, thank you. I've cited you there. We'd also have my other colleagues, Shidi Udoku, Michelle Ofoyeju, thank you guys. We also have Professor, and then we also have Sagir Daiba, Funsho Jimo, Dr. Moses Tinga. Dr. Moses Tinga was our guest on this platform recently. We also have Wire, and we also have Genetic Headsman, Agba Jeremiah, and a whole lot of others. We appreciate each and everyone. We'll continue to recognize you as we go on, but just let's pause for a moment now so that we can go in to read out some of the questions we have in our DM for Dr. Kabir to attend to them quickly. The time is running. 1 hour is gone. We have barely 1 hour left. Okay. Let's see how far we can go with some of these questions quickly. Okay. Okay, let's take this. Okay. Badiga is asking, are the effects of substance abuse on fertility reversible if the individual stops using? Dr. Kabir, that's the first question for you. Dr. Kabir.
Yeah, well noted. Do I answer or I should take?
Okay, actually the person is sent two questions, so let me quickly, if you have noted that, then the second question from the same person is, which substances, alcohol, drugs, tobacco, have the most severe impact on reproductive health? Let's take these first two first. Please go ahead, Dr. Kabir.
Okay, thank you very much, Mr. Badiga, with your lovely questions. Is effect of substance abuse reversible? the good news is that when caught early, where obstruction to the tubes have not like set in, they are reversible. That is the good news about it. The quality and quantity of both sperm and eggs are reversible when these substances are removed, and also supportive drug, like I said earlier, the antioxidants are given, are reversible. And as to which substance causes more effect on fertility, cigarette and alcohol is found to be very, very, they are very high in individuals that abuse alcohol and cigarettes.
That's that's quite shocking there. All right, are you done with that, Dr. Kabir?
Yes, please.
All right, thank you very much, Dr. Kabir. Let me quickly recognize Dr. Abdullah. Dr. Abdullah is a senior member of this platform. Dr. Abdullah is a consultant psychiatrist at the Ahmadu Bello University Teaching Hospital, Zaria. He joins us via the handle of SL Mental Health Foundation. Thank you, Dr. Abdullah. Let's take the next question. Can healthcare provide? Anyone that I think you must have answered in the course of your presentation, I may likely skip them. How can healthcare providers address addiction and fertility in a holistic treatment plan? Can the use of anabolic? Okay, let me take this one. Manny is asking, can the use of anabolic steroids cause permanent infertility in men?
Okay.
Yeah, you can go ahead, Dr. Kabir.
They are reversible as as soon as this substance are withdrawn. That's the beauty about infertility in substance abuse. Most times the effects are reversible. However, if the effect can be multiple. Somebody who is just taking anabolic, steroids, and say in the lady, and have what we call chronic pelvic inflammatory disease. Inflammation has blocked the fallopian tubes. So you see, even when it's withdrawn, what I said earlier, the effect might not be reversible. It has caused structural damage to the genital system. So that obstruction has to be taken care of, or the individual has to be assisted for the couple to conceive. Thank you.
All right, thank you there. We'll take another two questions from Obi Ageli. Obi Ageli is asking the first question: how does alcohol consumption interfere with ovulation and female fertility? That is one. Two, are women who abuse drugs more likely to experience miscarriages or ectopic pregnancies? Thank you for this beautiful presentation today, Dr. Kabir. I appreciate if these two questions can be responded to. Well, Dr. Kabir will respond to them now. Thank you, Obi Ageli. All right, please go ahead, Dr. Kabir.
Thank you very much, Obi Ageli, with your questions. You are asking how alcohol affects fertility. Yes, alcohol leads to imbalance in hormonal setting in a woman, and depend on the degree, of this imbalance, she will manifest. She will manifest in different scenarios equally. So that's what it does. Secondly, alcohol creates the production environment for the eggs and the sperm very toxic, with high production of free radicals. So this is how alcohol affects brings about infertility in them. So when the environment is toxic, of course, there will be reduction in the quantity of the eggs sperm that will be produced. Their quality will be reduced. They will be weak. They are likely to be abnormal. So when all of this put together, you find out that uh, the degree of infertility will be so high. This is actually dependent. Yes. Um, it causes miscarriages in women. But like I said, what the effect will be depend on might be multiple factors. Miscarriages and what is the other factor she mentioned? Yes, so it causes miscarriages because
And ectopic
for
pregnancy. Ectopic pregnancy.
thank you very much. Yes, yeah, ectopic pregnancy it causes both. Why? Because for normal, conception to take place and mature in the uterus, there has to be normal placental implantation and all of that. So you find out that these factors, when these women are against it, so miscarriages is very high in them. Two, ectopic pregnancy is high in them. Why? Because the egg supposed to actually migrate from the ovary, which is outside the fallopian tube and uterus, if you can remember the anatomy. Now, in a weak egg, floating might be an issue, movement will be an issue. So the sperm is likely to travel down the fallopian tube and meet the egg right there and fertilize it. So if that happens there, of course, implantation, the fallopian tube does not have the properties the uterus have for implantation, so it will lead to ectopic pregnancy. Yes, these two are high in women that consume a lot and abuse alcohol. Thank you.
All right. Thank you very much there, Dr. Kadbe. Let's take this one from Fedolapo. Okay, Fedolapo. Fedolapo is asking, no, not if this is Fedamola. Sorry, Fedamola. Can moderate substance use affect fertility, or does it only become problematic at the higher consumption? And first, I would like to appreciate the guest speaker for a no-holds-barred discussion, and I have learned a lot from him today. But kindly help me ask this question. Yes, I've asked that question. All right. Thank you, Dad. Damola. Please go ahead, Dr. Kaba.
Yes, Ife Damalola, thank you for your question. His question is catchy, if I may confess. Moderate substance abuse. I underline the word moderate. Now, if I said no, the individual might be very comfortable. And what moderate may mean to A is not same with B. However, the effect of infertility in an individual that takes substance abuse, like I said, might be multifactorial. Example, the individual may have anatomical anomaly, which we call varicocele. Now, varicocele is failure of evacuation of blood around the testis. Naturally, the testis produce normal sperm cells in a low heat environment. And testis actually, for the sake of our listeners here, the testis are originally produced beside the kidney inside our abdomen. But because the temperature inside the abdomen is very high, God knows that the testis will not be optimum in producing sperm. That is why it has to travel right beside the kidney to the outside. Now, here is testis that has what? Traveled all to outside. But yet, the individual had anatomical anomaly that the blood is not evacuated, and we know blood is hot. So if this individual that so-called take moderate substance has varicocele, so you see the effect is going to be more than an individual who does not have. So I will say that the individual should not take substance in moderation, thinking there will be no consequences. So that would be my comment on that. As to high dose, yes, of course. Like I said earlier, the effect of infertility are dose related. The higher the dose, the more the effects the infertility will manifest in the individual. I give an example of, a drunkard who completely is out of his senses. If he is to trek back home, he will not only stagger, sometimes they fall down. Some they have broken their head with head injury because their head hit the ground, or any other thing, with full force that will cause head injury. So you find out that an individual who took less of alcohol can trek home singing and happily reaching home. So high dose has higher effect on individual manifestation of infertility. Thank you.
All right, thank you too, Dr. Kabirga. We appreciate your time with us. Let me also quickly recognize Prince Eshimokai. Prince Eshimokai joins us from the US. Thank you, Prince, for finding time to be part of the conversation today. Let's take the next question from Shade. Shade is saying, okay, thanks NDLEA for bringing Dr. Kabir. I have learned some shocking facts today. This is mind-blowing. Now my question is, can marijuana use affect sperm count and motility? I'm asking because of the claims out there that marijuana is a herbal leaf. Thank you. All right, please go ahead, Dr. Kaba.
Thank you very much, Shade, for this question. Marijuana causes high generation of free radicals in egg and sperm production space. And yes, people has attributed it to be medicinal, but let's consider when abused. Remember, we are talking of substance abuse. Now, even when something is to do a normal thing in a person, when you abuse that thing, the chances are, of course, untoward consequences will result. So, marijuana, yes, if abused, will lead to one, decrease in quantity of sperm cells that we produce in the testes, and also quality. It's mimic mimic the findings in individual with varicocele. So the apart from low production in quantity, there will be abnormal cells. The cells will be weak. The cell, will be sluggish. So infertility will result in individual who abuse marijuana, despite it is good medicinal value. Thank you.
All right, thank you there, Dr. Kaber. Let's take this one from let's take this one from Victoria. How long how long after quitting substance use can fertility begin to improve in men? Is it immediate or could it take some time? I'm asking because of a personal experience. Thank you. Okay, there is also a second question to that.
Okay.
Can substance abuse lead to irregular menstrual cycle? Okay, I think you have, yeah, right. But let me ask you, but I think you have attended to this before. Can substance abuse lead to irregular menstrual cycles or premature ovarian failure? Please go ahead, doctor.
Thank you very much, Victoria, with your questions. Now, how long normalcy return from an individual who has stopped abusing substance will depend on a couple of factors. One, the degree of damage done to the ovary in case of a woman or the testicles in case of a man. Just as it is the case with varicocele, I will always be making reference to that. Now, an individual with varicocele depends on the degree of damage done on the testis. If the individual comes early, of course, as soon as you do the surgery, I have a patient recently who came out of the country. He flew in with varicocele because someone in the UK told him that he had the surgery in Abuja and his wife conceived. So they have to even collect money they paid for IVF. So he followed suit as usual. So he came. Actually, bare 6 weeks after his surgery, the wife conceived. Why? Because the damage done in his testis wasn't that much. So the recovery depends on the damage done. Two, the recovery will depend on the diagnosis made and appropriate supportive care given. Example, if we find out that the individual has poor quality of sperm, so we have to, apart from nutritional support, we have to give antioxidant in high doses, okay, to be able to create a better production environment. Now, let me just say this at this point. In a man, it takes 72 days for a sperm to be produced. So if we commence treatment today, we don't check whether there is improvement or not until after 3 months. That way, we have given time for those that were alive at the time of presentation have all gone. The new ones are produced. If they are now produced under better environment, we expect a good quality of semen sperm after 3 months assessment. So it's not something that will commence treatment a week later. You go to a lab secretly and then give your sperm to see whether treatment has. So I need to see this so as to one, the duration can be that long. However, once again, it depends on the degree of damage done. Two, irregular menses, yes. Substance abuse can lead to irregular menses because it leads to what? A more hormonal imbalance. So if that is diagnosed and the individual is, withdrawn from the substance, sometimes normalcy return on its own. You just have to just give the supportive care, but otherwise, appropriate medication need to be given. Example, if the individual has hyperprolactinemia, of course, so you have to give a tablet that will lower the level of testosterone. Like in men, we found that hyperprolactinemia among the imbalances and low testosterone. These are common hormones that goes haywire. So good enough. There are medications that you can give to support this, and then normalcy resumes. Yes, I think premature. There's something about prematurity also. The third question. Hello.
Yes, let me quickly check that. That's for can certainly to
The third question.
yeah, premature ovarian failure.
Exactly. Yes. Thank you. Ovarian failure. Yes, it can lead to premature ovarian failure because, like I said, if the environment, is making the ovary not to perform optimally, there will be a continuous decline as far as these substances are not withdrawn. It may lead to total failure. Thank you.
All right, thank you very much, Dr. Cabral. Interesting conversation here today. Let's take some comments or reactions from the X platform here, X space here. Let's take let's ask one pen, that's Ahmad, to unmute himself, and let's hear from him. And after that, we'll go to Gideon. Yes, Ahmad, please go ahead.
All right. Good evening, everyone. Can you hear me, Mr. Elephant?
Yes, you are loud and clear.
Okay, good evening, everyone. Good evening, Doctor. Thank you for
Good evening.
Thank you for such a beautiful and amazing presentation. However, for people like us, we'll just be nodding in amusement and, of course, in I would say regret, quote and unquote, regret. However, I just want to ask, what would you advise a survivor to do in this situation? That is one. Then, secondly, Mr. Referee, I just want to say, look here, I've been attending a lot of spaces on X and got to kind of there's this.
Thank you, Ahmad. Doctor, you want to say, I think he has a question first before making the other comment.
Yes. Yeah, the question he asks. First of all, Ahmad, thank you very much for availing yourself to the reality of what you passed through, and you are not ashamed to share your stories because you believe your story will touch and save somebody. Thank you very much. And to what you asked, survivors like you, what can you do living with consequences of some of these things we are discussing in this piece? Specifically, if there is a component of infertility in any form, be it erectile dysfunction, like we said earlier, the beauty about it is that they are reversible. Okay? You need to see a specialist, see a urologist who will reassess you, evaluate you, and appreciate the degree of the problem. And I think from there, when appropriate measures are taken, the good Lord will visit you and change your story. This you said, let me share one of my patients, his story. He abused substance to an extent that he can't sleep with his wife. 6 years down the line in marriage, the wife wasn't pregnant. Why? He could not even sleep with her. And she said she will remain faithful. She won't go out to sleep with another man and bring the pregnancy and dump on her husband. She resisted that. She insisted. The family initially were even suggesting for her to sleep with his brother. She refused. Just this issue of, family resisting exposure, So, but finally, because she insisted, she had to let her people know what she's passing through, and then her brother stepped in actually and encouraged the husband people, and finally they came. We're able to get him out of the substance. His quality of sperm was terrible, not only low, was very, very bad. And to God be the glory, appropriate treatment were given. As we speak, they have 2 children, happily married now. always come around to say thank you for being there for us and all of that. And I sincerely appreciate this wife. I respect that woman. Why? Because she said she will remain faithful. There are many who are not faithful in these situations. Also, what can you do? You have taken a bold step to create a space on your own to educate people. I will advise that you bring in people to your space, just like this agency are doing, who can talk to your audience on some specific areas where, the consequences of substance abuse. I think that way you will be able to maximize your own space. I think that's what I will say for now. Thank you.
Thank you very much. Thank you, Dr. Kabir, for also sharing that experience. That those are the things that encourage quite a lot of people on this space, because this conversation is recorded, and even after the space, it travels far and wide across the world, and quite a lot of lives are being touched and impacted by some of these great insights. Once again, I would like to appreciate Dr. Kabir for that great insight. Okay, let's take the next contribution or question from Gideon. Please, Gideon, go ahead, unmute yourself, and let's get your intervention.
Yes, thank you. Thanks, everyone. Thanks, you host and co-host. Thank you. Yes, my name is Gideon. Yes, I'm a Nigerian, and I like to see Nigeria work. Can anyone hear me?
Yes, we are hearing you. Obviously, you are at work. I know those of you in the US, this is your morning time.
Okay, yes.
Please go ahead.
Okay, yes, I want to see Nigeria work, and yes. So, yes, I have the experience. I have worked with the correctional centers, mostly the juveniles, those that have that were locked up because of drugs, carjacking, kidnapping, robbery, and doing my jobs, like how I was trained. Most of them were involved in drug abuse, and that's the root cause that made them to do everything they did. Yes, and during my training, I discovered that they were abusing drugs, mostly the high drugs that are very, very dangerous to them. So I have learned a lot, and I have also brought it to my village through education and creating awareness, because I have seen the consequences, the effects of drug abuse. One of the effects is mental health. Yes, it is really sad to see someone, your relative, your brother or your sister or your uncle, behaving abnormal as human beings. It feels sad. You see someone who is in school turned to be a mad person. It really feels sad, and I've been working towards it. Right now, I have more than 100 people that I'm empowering in my village to help report people selling mostly the wigs and what they call so-called murumiri. Yes, I empower them, I give them money, I mobilize them, and tell them to report everything to the police and to the NDLEA. I give them money every month. I tell them what to do, and I encourage them to go out there. If you see anyone, report them. Don't wait for the police. Report them so that they can come and pick them up. Because my family have been involved. My uncle, my cousins. Yes, because when I look at them, I cry every day. That's why I'm getting involved to make sure that Nigerians the government can help to reduce the effects of drug abuse. Yes, I cry. Like I see my cousin who have traveled outside the country. He came back home, get into drugs, and he's just a mad person right now. And I feel sad. So that's why I'm getting involved. Anyway, I see anything, how to help the people, I'm ready and willing to come out to talk to the people, mostly education, and I think we really need education so that we can help people get out of the situation. It doesn't matter who is involved. It can be me, it can be you, it can be anyone. So this is my own contribution, and I've been doing it, and if there's anything I can do to help to reduce the effects of drug abuse, I think I'm willing to do that. And I want to thank you guys for hosting this kind of space, and thank you all for all you have been doing. And I'm willing to help in any way I can. And also I want to share this. People are getting mad, mostly our village people. Yes, for example, most of them are not on the Twitter, are not on the space because they don't even have the sense to come on the space to talk. Yes, so it's our duty for us to forward the message to them. Yes, so we need to really expand the message to them, tell them what tell them the effects of drug abuse, mostly getting mad. If you get mad, that is it. Brain is like a box. Once the box is broken, you can't get it back. So it is very, very dangerous for people to get into drug abuse because I have witnessed it where young people between age of 25 and 22, 23, 25 years just waste their life because they want to test a drug. They want to test it. Yes, so it's never, never good. And I want to encourage you all for doing the good work. Continue to do the good work so that Nigeria can be a better place for all of us. Yes, thank you. And
Thank you.
I use my mic.
Thank you, Gideon. Thank you for all you do also. Thank you for your time. Thank you for all you're doing for your people back home. We appreciate you. That's a good one for everybody. That's inspiration for those that may still be standing by. That this is a collective thing. It's what each and everybody needs to get involved in. Okay, thank you once again, Gideon. Would Dr. Kabel wants to say something to that?
Yes. Thank you, Gideon, for that contribution and that great work you are doing, for your people in the village. Um, you can see this just to encourage people, get involved in one way or the other. If people are getting involved, hospital-based data. That is what that's available. But as to go into the community and then get this done, we don't have. Both on those with substance abuse and as per those who had from treatment and outcome. Also, there are hospital-based data that if you are interested, I can get them across to you. Okay? Yes. But it would have been better actually if we can go to carry out this research in a community base. That will be more helpful. But one of the challenge we found we encounter here in this kind of research is that we are in a society whereby people are not even forthcoming to say they are abusing drug. That is one. Two, even when you identify the person, he will not consent to partake in your research because it may seem you are exposing him. There is this issue of trust with data. Even our experience with known diseases like say prostate disease or cancer of the prostate, when you approach
Let's quickly, our time is fast spent. We have less than 20 minutes left. Okay, let's try to see what. Okay, let me quickly take this one from our DM from Tajuddin. Tajuddin, thanks for the great insight, Dr. Kabel. You have simply shown that quite a lot of brilliant minds in Nigeria and those of us in diaspora are really happy when we come across people like you. Now, my question, in the case where both parents are recovered or treated, recover from drugs, does this have any impact on their unborn kids? Okay, I think I got that now. All right, that's the question from Tajuddin, Dr. Okabe. Please go ahead.
Okay. Thank you very much, Mr. Tajuddin, for your kind words. Appreciating some of us from home here. Yes, when we hear this kind of comments, it's quite heartwarming because sometimes we feel as if we have committed offense by staying or coming back home. You know, thank you very much. When both parents are treated from substance abuse, what happened to the unborn child? You remember in my opening statement, I said drug substance not only damage the person taking it, but what? It kills generation unborn. Once the parents are treated, there is what we call post-treatment evaluation. You know, their fertility need to be imagined. To say at ejaculation, a man, produces not less than 25 million sperm cells. Just to tell you, the kind of cell division activity that goes on in the testes. So there is renewal, turnover, which is quite high. So normalcy can quickly resume once the environmental factors that affected the fertility are removed. So it's a
One, the
involves, the psychologists. In one facility whereby the processes of withdrawal has been reasonable enough. Now, subsequent care can be instituted alongside withdrawal, so that the team can even discuss, come together, have a conference on the abuser as to the best way, he can be treated. And sometimes this discussion takes place with the person in attendance. By the time he is seeing, oh, the whole team have gathered for his sake or for her sake, you find out that the person compliance will be very high. His hope will be very high. His enthusiasm in the management and cooperation will be maximum. So if this can be found in one facility, we encourage that. There are instances whereby the individual has to be attended to, say, in the psychiatric hospital first, until the person is, taken to a safe level whereby he is now appreciating the burden of his problem and willing to give himself. Like I said, the person has to cooperate alongside his team. So in this scenario, the person needs to be treated in a different facility, and thereafter, other care can commence with expectant good outcome. So that is how we go about handling individuals like this. Thank you.
All right, thank you there. We're approaching the end of this conversation today. Then let me ask this. I have two questions from Umu Khartoum. Umu Khartoum is asking one. I believe this has been responded to, but then let me ask it since it's the first question here. Is there a possible reversibility when one stops using drugs? I believe this has been. The second question from Umu Khartoum is, in a situation where
don't think I'm not a don't know. Don't be a drug addict. Me a part of me. I next want to carry them. Even though you never, even though you want to, I really don't bother. You know, you know.
So, to make his final or last remarks, and then we would be drawing the curtain on the program today. We would like to appreciate everyone that has been. Uh, Quickly wrap up to round up the program. So, Dr. Kabir,
Once they are with attend to the women, we have to insist on getting them off their drug by every measure possible, and then care given. By this question, I'm impressed because you love the person, knowing that the person is even involved in drug, yet you still want the person as your husband. So that degree of love you have for him will go a long way if the man is made to appreciate your sacrifice. It will also help him. And then, of course, the man will live a normal life, and you are very much likely to have children in your life. Thank you.
We should actually be saying thank you to you, Dr. Kaba. Let me quickly read this. There's something somebody said that's Olalekan. In Nigeria. I don't know if Dr. Kaba wants to say something to that.
Yeah, I want to add that our audience is not just restricted to Nigeria. So that was why I talked the way I did. Thank you very much for, emphasizing here in Nigeria is not allowed. It's illegal. It's an illicit substance. So, if Nigeria say no to it, it's actually saving its population and generation, future generation. Thank you very much.
All right, thank you very much. We've passed the hour of 5 already. Would like to most sincerely, on behalf of the Chairmanship Executive of the National Drug Law Enforcement Agency, Brigadier General Mohammed Buba Marwa, retired, and our entire management team, express deep appreciation to Dr. Kabar Dajuba Usman, a fellow of World Endurology and Director of Urology at the State House Medical Center, Presidential Villa, Abuja here. We appreciate you very well, Doctor, for being with us for the past 2 hours and giving great insights, doing great justice, and giving a good account of yourself. You are widely appreciated world over, and that's for really doing a great justice to our topic today.